This slide shows the 28 focus areas, okay, and gives a snapshot. It's probably difficult to see out in the ether there, but it shows how many of these met or exceeded the target. That's the dark color, and those are the ones. That's the area at the bottom of each of these columns. And then it goes up to some, all the way up to some objectives that were dropped at mid-course. But we'll get into this in more detail. Let me return to the first slide again, which is the next slide. This just shows that this is immunization and infectious diseases, and then we can see medical product safety. But we'll get into this in more detail, and I'm happy to answer questions about it. Then the next slide. Please. Yeah, there it is, the two overarching goals. So I want to really kind of begin at the top. We started out with 900 objectives, and then we've got 733 that are evaluable because we have the data. And at the top of all of this are these two overarching goals. One, to increase the quality in years of healthy life, and the second, to eliminate health disparities. And the template that was used for Healthy People 2010 had these 7 topics or factors or areas: race and ethnicity, all the way down to sexual orientation. We have differing amounts of data for each of these, but we do have data on just about all of this, at least for some of the objectives. So turning to the next slide, okay, this is the picture of life expectancy from the millennium, I guess we could say, from the year 2000 up to the most recent data, which is 2006 and 07. Actually, there is more recent data, and you'll be able to find that on the NCHS website if you look at the mortality data. But in terms of putting the report together, this was the most recent year that we had. This shows a remarkable change, okay? It shows that life expectancy at birth actually increased by 1 year. That's in less than a decade, which is really quite remarkable to see that. It also shows that there is a considerable disparity between black life expectancy at birth and white life expectancy in birth. Now, many of you, I'm sure, understand exactly what that means, but let me just take a minute, because I think it's tremendously important. It means that a child, based on the statistics that we have today, that a child born today, a black child today, will live, on the average, 5 years less than a white child. That's the heart, and that's really probably the signal statistic when we look at disparities. And we can look at the rest of all of this as kind of feeding into that. What are the differences due to? Have there been changes over time? But it's interesting, though, there's another factor that we can look at, fact that we can take from this, which is if we look at the difference between the black and the white rates in the year 2000, the difference was 5.5 years. Today, in 2006-07, the difference is actually 4.9 years. So, in fact, the disparity is going down. Okay? And that's a positive point. Turning to the next slide, we can look at life expectancy at age 65. And this has a couple of imports here. First, it says that if one is age 65, there's about 18 years of life remaining on the average. Could be more than that, of course. It could be less than that. And what we see is progress between 2000 and 2006, 2007, where it's just about a year of additional life that has been obtained. But there are other ways to look at this, particularly from the standpoint of the quality of life. So if we go to the next slide, we see that we also analyze this in terms of whether those years are in good or better health, free of activity limitation, or free of chronic diseases. And what we see, there's about 14 years of life remaining in good or better health. Of course, this is on the average again, and about 12 years in free of activity limitation. And we can see progress with both of those, in which both of those have gone up since 2000. However, in terms of being free of chronic diseases, there's only about 3 years that we can expect over 65 on the average, where one would be free of chronic diseases. Some more, some less. Some enter 65, of course, with chronic disease. But it's really interesting that there's been no change there. Go to the next slide, okay, and this brings us to Goal 2, health disparities. We looked at one case here, life expectancy, but when we look across the 733 objectives that we can evaluate, we see substantial health disparities, period. Not much I can say, and we'll see more of that. Most objectives had actually no change in disparity over this time. And the word that keeps coming to my mind here is that health disparities persist. I think that's the operative word. They were there in 2000. They continue today with relatively little change. Well, the report, on the next slide, the report goes into tremendous detail on all of these objectives, all 900 for that matter. And there are many, many different ways to analyze it. One way is to look at these disparities by race and ethnicity. So each column here represents a particular race or ethnicity, and what we look at here is whether or not that particular race, or how often among all of these objectives, that race had the best rate, okay, or had a wealth of gradations down to the worst rate, okay? And we could do it, talk an hour or more about this. But going to the next slide, I think I can summarize sort of the key point here, which is that in case of whites, whites had the best rate in an objective, the best value, the best measure. Not all of these are rates, but the best measure for 51% of the objectives in which they were measured. Okay, and not all, but in 51% of those. Okay, and it turns out in this case there were 354. I know from the prior slide that in which they were measured. The case for blacks, who were measured in 345 of these objectives, they had the best rate 20% of the time. Hispanics, 17% of the time had the best rate, and American Indian or Alaska Natives had the best rate 6% of the time, just to pick these four. This is, again, I think a very strong statement of disparities. Now, what about change over time? The next slide shows how. Doesn't show how exactly, but it gives the results of looking at the change in disparities over time. I said earlier that the disparities persisted and there wasn't much change. Well, here is the case for race, okay, in which we could look at the different races, and summing this up, we see that there was no significant change in disparity for 117 of the 169 objectives in which we could calculate this. So for that 169, 70%, essentially 70%, showed no change. And the bright green shows the number of objectives in which there was considerable disparity decrease, very positive, and the bright, I guess that's maroon, I'm not good on that color, shows the disparities, or shows the number of objectives in which disparities, in fact, greatly worsened. The point is there are some, of course, across the spectrum, but in general there's relatively little change.